hello everyone. Welcome to this podcast. This week, we're going to talk about concussion. There's going to be three parts of this topic. So we're going to talk about concussion part one. This is today. Part two, which is going to be in 2 weeks. And part three, which even Tracy or even Vanessa, hi to you too. Even they don't know that, but yeah, it was confirmed yesterday. We're going to have a special guest for part three. So the part three will be with Ryan Carey. Ryan Carey is an ex-military. He was a captain with the RCR, and he was also an ex-CFL player. So he played in the CFL for I think it's 6 years in the 90s, and he is working right now for the Foundation of Concussion of Canada, and he agreed with us to come on the podcast on the third part, the part three, and we're going to talk about concussion. So if you do have any questions about any concussion topics or question, feel free to be present during that podcast. It's in mid-August, so today 9th of July we will talk, and I'm talking like we as you can see I'm alone, but Gian will be with us today, but not live. We did like a video yesterday. She couldn't be live with us today, so her part will be already recorded. So I'm going to play her part on the video later on this podcast. Good question, Tracy. So the first part is today. Part two, it's going to be July 23rd. And part three will be mid of August or 2 weeks after July 23rd. So that should be 14th of August. I don't know if I'm really good with calendar in my mind. Let's see. It's going to be the 6th of August. So also with that, that's going to be probably our last live, the 6th of August, our last live podcast. We'll see how it goes. It's not, I'm saying that we're going to have no more podcasts after that. We're still going to do some podcasts. We're just going to probably pre-record it and then broadcast after. We'll see how it's going to go for all the other podcasts. But as we go right now, the concussion sequel, if I can say that, that's all going to be live. So don't miss it. Put it in your calendar if you do have a chance to participate. Come here on that podcast. I can see that Fullwood, that should be my sister. She's on the podcast today, and we do have our normal people that are always here on the podcast. So during that podcast, I'll try to shoot the document that we're all going to talk about today. And yeah, and if you do have any questions, go ahead, just put it down in the comment, and we'll try to do. We're trying to do, like, actually it's going to be me who's going to answer the questions, but yeah. So the first one in the comments, if you guys are listening right now, I would like to know how many of you know what is a concussion, and if you do, just say yes, I know what is a concussion. And if you know what is the difference between a concussion, a TBI, or any kind of stuff like that. So Vanessa said yes. Tracy said kind of. For the others, if you can answer, go ahead. If not, that's all right. If you want to keep your knowledge into yourself, like just for yourself, that's all right too. But yeah, there's a big kind of some difference between a concussion and some other stuff like a TBI. TBI, it's an acronym that says traumatic brain injury. So my second question before we start, I would like to know if you guys watched the movie of Will Smith, Concussion. if you did had a chance to watch it, I think it was out 2 years ago, um, 2 or 3 years ago. So Will Smith does. He's playing an actor, a doctor, and he's playing a doctor who's doing a test on a next NFL player. Don't worry, there's no spoiler alert. But if you didn't watch it, I would really, really recommend for you guys to watch it. Really good movie that really put in perspective what is a TBI. And technically, when he analyzed the TBI on the X player, it's he realized that the player died from a lot of complication with multiple concussion in his career. So the player was an ex NFL superstar, ended up his life really bad, and then this doctor who is Will Smith. He's doing a research and trying to find out, trying to defend players or people who are suffering for that kind of disease or problem complications. What's really nice about that movie, it's based on a true story. So the doctors still work today in the United States, and he in that movie he kind of like he doesn't really attack the NFL, but it's kind of like the NFL is pretty much um, attacking that doctor, saying that discredit all his research and all that. So it's a really good movie to watch. If you didn't have a chance to watch that movie, I would strongly recommend, just to give you a good heads up on this topic. But today we're going to talk about concussion. So um, let's start with that. So now, what is a concussion? So I know that my sister just asked me to tell you guys what is a concussion. So I'll give the definition of the CDC. According to the CDC, a concussion is a type of traumatic brain injury, or what you're going to hear today during the podcast, a TBI, caused by a bump, a blow, a jolt to the head, or by a hit to the body that caused the head and the brain to move rapidly back and forth, as you can see on this video. So let me show you, share my screen. Let me show you what I mean about concussion. There you go. So this video doesn't have any volume, but you will see a lot of different kind of concussions. So right here you see a lot of football players. You'll see also hockey, a lot of different sports that do have concussion, or you can see the concussion right here. So this sudden movement can cause the brain to bounce around or twist in the skull, creating chemical change in the brain and sometimes stretching and damaging brain cells. So, what you don't know, or probably the way you can see what is a concussion, it's more the brain is inside a skull, so the skull is supposed to protect the brain from anything that's exterior from it. But as you can see on these videos, the brain, the skull becomes kind of the enemy. Just because the brain moves freely inside the skull, that doesn't mean that you are protected. It means that your brain will squash into your skull, and it can arrive at different multiple ways, as you can see on these videos. You can also see like car accident on this video. It's only going to be sports injuries, but it can also happen with the military when you do some type of training. So yeah, as you can see, and also every time we talk about it, we want to talk about the military, have a relation with the military. This actually, this video, I like it because this is when Max Pacioretty got the concussion. You can see it on slow mo right here. Probably if you're a Canadian and you watch a lot of hockey, you will remember that incident with Zdeno Chara, who pushed that guy to the board, and he got the concussion. So basically, he was out of play for a long time, came back. There's another player that you guys might know, Sidney Crosby, who did also got um, a concussion and multiple concussion when he was in the junior major hockey team, and then when he started in the NHL, the concussion came back. Still had any issues with the concussion, and then he took a year off and fixed his concussion problem. And then when he came back, since that day, he probably had other injuries, but it was not related to his concussion. So we'll talk about that a little bit later. But yeah, the military are also at risk of a concussion and TBI. It's caused by a fall, vehicle accident. Obviously, when they do training that is for war or security. So that's why sometimes it's not going to be um, a safe training, but they can make it as safe as possible. Also, bullets, when it hits your helmet, it can cause um, a TBI or a concussion, and also shrapnel, blasts, and all other stuff. There's also a good example. Do I talk about that later? Yeah, I think I do. Um, in fact, emergent evidence suggests that troops may be exposed to hazard to the brain during training as well. In recent years, research has begun to understand that the primary blast pressure wave from explosion can also damage the brain, although the specifics mechanics of the injury from the blast is poorly understood. So a good example of that is a grenade. When the grenade explode, that will create a blast, and that can also create a brain injury. So it's still recent and in the research, and they're still trying to understand that. Another concerning fact is that evidence suggests that military members may be exposed to significant levels of blast pressure, overpressure, when firing heavy weapon such as recoilless rifle, such as the Carl Gustav weapon. The Carl Gustav weapon, I'm a civilian, and I did had a chance to shoot that weapon. That was probably 2 years ago. If you don't know what that is, it's kind of like a big bazooka. It's an anti-tank rifle, and it does create a big blast. So studies are even showing that multiple exposure in a day can result into 30 to 40% greater physiological change than just a single exposure. So for myself, when I shot the Carl Gustav, it was just a simple exposure. I could have had a brain injury, but it's more if you do it multiple times, such as a training. That means more exposure lowered the threshold for injury. Also, they also suggest that even a 24 hours recovery, it's not enough. Now, other studies have found higher rates of concussion and post-concussion associated symptoms among individuals with history of prolonged low-level blast exposure from breaching and shoulder-fire weapons. However, more studies are needed to better understand the injury mechanic among these soldiers. But for you at home, it's important to understand what are the cause of the concussion, so you will be better suited to know how to prevent them. So also, all the studies that I'm talking about while I'm going to show the video right now, I will put also the links of the concussion, so you can read these studies if you're interested. So Gian will show us how can we prevent any concussion in that case. So let me just start that video. All right, so Gian, can you help us understand how to prevent a concussion?
Mhm. So I think it's really important to remember that sports-related concussions are predictable and preventable. It's shocking, actually, how many people I told that we were going to do this topic about concussion prevention, and they were kind of like, "Well, is there really anything you can do?" And specifically to sports-related concussions, absolutely. So I think we need to first consider there are two different categories of risk factors. So we have extrinsic risk factors, which are external to the person. So those are things like the type of sport, the type of session, the equipment, and the rules of that particular game. Intrinsic factors are things that are inherent to the individual. So things like previous history of concussion, the size of the player compared to the others, pre-existing symptoms, as well as an individual's neuromuscular control. So we have both extrinsic and intrinsic factors that can change or increase or decrease our risk of concussions. So that's important to remember. As a healthcare person, we look at three opportunities for prevention. So the first is the primary level. So basically, this is looking to prevent or decrease the risk of injury for healthy individuals. So we have the opportunity to influence many people in the primary level. The secondary level, we target those who are susceptible. So we're looking at early diagnosis and prevention of recurrence. So at the secondary level, we have an opportunity to influence a smaller group of people. The final level is the tertiary level. So we're looking at prevention of the long-term consequences for those who have already suffered from a concussion. So there were even fewer. So when we're looking at prevention strategies, we get the most bang for our buck by targeting the primary level because that affects the greatest number of people. So we have three targets for concussion prevention. The first is rule and policy change. So for example, there was a 64% decrease in concussion rates with the removal of checking in Pee Wee level hockey. I know that was controversial, but in terms of Pee Wee level hockey, huge decrease when they removed checking from that level. So that actually ended up being 4,800 fewer concussions in Canada in the first year. So a significant number for sure. So these numbers, yeah, it is huge. So these numbers are consistent between elite and non-elite level athletes. Restricting contact practices in football resulted in a greater than 40% reduction of the number of head impacts in games and in practices. And there were two studies done in 2016 that demonstrated that restricting contact practices combined with coach training in matters such as tackling technique and equipment reduced practice concussion rates by greater than 80% in football specifically. So the second target that we look at is equipment recommendations. So there was a 2017 study done by Chisholm et al. On mouthguard use. That particular study showed approximately a 15% reduction in concussion risk for those who use mouthguards consistently. It is considered, however, that the use of mouthguards does require more research before we go out on a limb and say that's an absolutely wonderful thing to do. But there's some preliminary evidence to support that. As well, helmet fit is really, really important. So there are 19 validated criteria for youth ice hockey helmets in terms of fitting specifically. So things like the fit of the chin strap, the position of the helmet, the condition of the helmet. Again, there's 19 criteria, not the focus of this podcast, but we could provide that information if people are interested. If more than one of these criteria are not followed, the risk of concussion increases greater than twofold for these athletes. So super significant. And Francis, you were going to talk a little bit about helmets.
Yeah, for sure. Because since I'm a trainer with a lot of hockey teams since 2007, what I would say, what I really see often right now is like the players, the teenagers, they like to modify their helmets to better suit their performance. I would say like they're gonna tape their straps. They're gonna also like remove their cage or trying to open it. Now we all know that referees are responsible to enforce these kind of measures. Like if they see anything like that before a game, they will have to just do a warning to the coach, making sure that this player or these player are all fixing their helmets. And then if they don't do that, they will give penalties to these player. And it's a really salty penalties, like it's a 10-minute misconduct. And if they don't fix it after that, they can be expulsed from the game. But what I would say, it's pretty much as a hockey player or as a coach or even like as a parents, you need to reinforce the importance of putting your helmet properly. Because even like Gian said, if you're not putting your helmet properly, if you're not setting up your stuff or you're modifying the purpose of the helmet, it's pretty much useless. So you're pretty much doing like erasing everything that the helmets are supposed to do. Now, even remember in the NHL, there was some players, hockey players, that was taking everything inside the helmet, like all the cushion that we had in the helmet. Now, I don't know if it's really lighter or you're going to skate faster by doing this, but I'm pretty sure that if you do fall or if you do have a head contact, you will have a concussion. And a concussion, you will see later in that podcast, it takes a long time to fix or to just recover from it. So why not just prevent it from the start, from the get go, and don't modify it because it's cool, because it looks cool, or whatever. Like, I don't even know what's the reason behind this, but even if you're a parent, a coach, or even a player, you got to enforce the proper set of a helmet. Football players, they might do that too. I'm not really in that sport, so I can't really tell. But I would say that all the contact, all the physical contact that you will have, the tackles in football, it's always a head first. So head to head first. So I'm pretty sure they're gonna wear their helmets pretty properly, just because they know that the impact is over there. Hockey, it's not always a head contact, but you have greater chance to have a head contact. So yeah, that was my field experiments that I would say about equipment. Make sure that you wear your equipment properly, and when you see that your equipment is not providing all the security that you need, buy a new one or just get rid of it and get a new one for sure.
Yeah, it's not worth the risk, that's for sure.
It is not worth the
Absolutely.
risk.
Yes. So our third target for concussion prevention is training strategy. So warm-ups and neuromuscular training have been shown to decrease concussion risk by greater than 50% in rugby as well as soccer. So tackle and checking training specifically, there is more evidence required to support these scientifically, but they do seem to be logical recommendations. So just a quick example, because you think neuromuscular training, well, that's a great idea, but what does that really mean? So looking at things like dynamic stretching, eccentric strength, agility, jumping, plyometric and balance training, as well as controlled rehearsal of landing and cutting maneuvers done both in warm-up and at home. And the research has looked at home sessions being about 3 times per week. And this is superior to the standard warm-up, which consisted of static and dynamic stretching, as well as aerobic components and just home-based stretching. So throwing in some of the agility, the balance, the jumping and plyometric stuff can really help reduce concussion rates.
Another thing that I can add, Gian, on that, it's even during university, our coaches were or teacher were pretty much saying that to us. Concussion can also occur in soccer, for example, when you're doing not a head contact, a head hit with the ball, and like one head hit could probably provoke a TBI, a traumatic brain injury. But that's not the purpose of what I was about to say. It's more block training. So if you're a coach, you probably know what I mean about a block training. Block training is when you're going to do one exercise in the block and you're going to repeat it multiple times. So if you repeat it 10, 20, 30, 40 times, this can provoke something really dramatic. If you're doing some head hit with the soccer ball 10, 20 times, you probably know what I'm talking about. Is you're going to have one player on one side, the other player right here too. One has the ball, throw the ball to the player hit it with his head, you catch it, and you do it 20 times. Now in soccer, if you're a coach, your federation must tell you to not do that, because that will create or can create or increase the chance to have a concussion. But this is a good example of your type of training. When you train your athletes, you got to train them the smart way. So think about what you're doing and don't do some block training with the head contact. That's the worst thing to do. You're going to see it in hockey also. If somebody has a concussion, they recover from it. The first thing they do is when they go back on the ice, they will have a penny, and like a really obvious color penny, like an orange or yellow. And when they're on the ice, nobody can touch that guy. So he or she's going to work with the puck and agility, and he can or she can do some drills. but with no contact at all. And after a while, we're gonna take the penny off, and then they're gonna reintroduce their drill with contact. So, as a coach, you have to be a good example to your players, and as a player, you have to think smart also. Don't provoke any injury, because a concussion is very dangerous. So that would be a good example of what I see in the field, and just try to prevent that from happening.
So just as a summary for concussion prevention, just please remember that concussions can be prevented in sport. The three primary targets are rule change, equipment recommendations, and training strategies. And partnerships with schools and community organizations are essential to success and in meeting these goals. So then we're going to talk a little bit about detection too, for my part. So if you don't mind, Francis, bringing up that CRT5.
Yep.
So in terms of detection, so we talk about the 3 R's. So is to A, recognize, to B, remove from play, and then to C, reassess or refer. So of course, recognition is the first part of those 3 R's. So lay people such as parents, coaches, players, and associations use a tool called the CRT5 for concussion recognition. So that stands for, that's the concussion recognition tool, and it's the 5th edition or 5th version of it. And we're going to go through that with you. Healthcare professionals use the SCAT5 in addition to a clinical exam. There's also a child SCAT5, which can be used in addition to a clinical exam. But because this presentation is directed to lay people, we're going to go through the CRT5 with you guys. So the first thing that's very, very important are the red flags. So they're listed on the document. So what we're looking for are the red flags: neck pain or tenderness, double vision, weakness or tingling in the limbs. We're also looking for severe or increasing headache, seizure or convulsion, loss of consciousness or deteriorating conscious state, vomiting, especially if repeated vomiting is present, or increasingly restless, agitated, or combative behavior. So those are our red flags. So it's important to remember that there may be other serious neck, spine, airway, bone, joint, internal injuries. So people can have a concussion that's certainly not an isolated injury. It can be in combination with some other serious things. So if these red flags are present, we do not attempt to remove the helmet or other equipment unless you've been specifically trained to do so, because again, we want to protect the spine in case it has been injured. And then we just follow the basic first aid principles in terms of airway, breathing, circulation for these folks. So if the red flags are present that we went through, and that should be on your screen as well, we need to remove the player safely from the field, but only if you know how to. So this includes the ability to stabilize the head and neck, and then we call an ambulance. So red flags, really, really important, ruling out other more serious things. The second step of the CRT5 is looking for signs. So these are things that you observe. Symptoms are what the patient or the individual reports. So in terms of the signs that you're looking for, you'll be looking for things like the individual lying motionless on the playing surface, if they're slow to get up after a direct or an indirect hit to the head, disorientation or confusion, the inability to respond appropriately to questions, blank or vacant look, balance or gait difficulties, motor and coordination, stumbling, slow and labored movements, or a facial injury after head trauma. So those are the things you are looking for. If those are present, we suspect a concussion. The third step is figuring out what the person's symptoms are. So what they're reporting to. So we look at different categories of symptoms, because again, a concussion is a very multifactorial situation. So the categories are physical, emotional, cognitive, balance, and then later we're also looking for sleep disturbance. So the most common symptom of an individual who's been concussed is a headache. They may report, so again, we're looking at symptoms, they may report pressure in the head, balance problems, nausea, drowsiness, dizziness, blurred vision, sensitivity to light, sensitivity to noise, fatigue, low energy. They might say, I just don't feel right. They may be more emotional, more irritable. They may be sad, nervous, or anxious. They may report neck pain, difficulty concentrating or remembering, feeling just slow or sluggish, or feeling like they're in a fog. So those are some of the symptoms that we're looking for. So again, if someone's had an injury and they're presenting with those symptoms, we become suspicious of concussion. So the fourth and final step of the CRT5 is a memory assessment. And this is most appropriate for athletes who are over 12 years of age. So some of the things that you may want to evaluate in memory assessment are: what venue are we at today? Which half are we in? Who scored last in this game? Which team did we play last week? Did your team win the last game? So those are just some things to use to evaluate memory. So I think that's my part.
Yeah, and as you can see on the CRT5, on this part right here, try to follow these recommendations. So if the athlete is suspected to have a concussion, he like don't leave that person alone for the first 2 hours for sure. Just make sure that he's not drinking alcohol or consuming any kind of drugs. And also, why not sending that person to the hospital? It's always important to make sure that there's no internal bleeding or any other complication that you don't want to have. So, sending to the hospital so we can check up, do a good checkup, and make sure that this person will not have a precedent from that injury. For sure. So this is a really good prevention chart. You guys can follow it and make sure to know what it is. If you are a person who's gonna, like a parent or even like a trainer or a coach, you got to know what is a concussion and at least the minimum thing if before a game, before a tournament, before any kind of like intervention, and have a copy with you. Why not?
Mm-hmm.
Printing these copy are always going to help you to prevent or to have at least these paper with you, and then if something happened, why not, you can follow it and just if you're not sure of what you're doing, first thing, like Gian said, don't move the head, because you don't know if you have that person has a spinal injury, and I'll call the ambulance and just wait for it. Don't be a doctor here. We don't want you to be a doctor, like, but you want to be safe, and don't think that anything it's easy. When you don't see the injury, you don't know what it is. So make sure that you're going to check that up from a doctor or a professional, a health professional. All right,
And we're
thank you,
going to
Gian.
talk more about the next steps to take on our next podcast about concussions.
Yes. So thank you, Gian, and
You
we'll
bet.
see you on the next podcast.
Sounds good. Thank you.
See ya. All right. All right. Sorry, everybody, for that are listening right now. It seems that the volume was not really transmitting on your side. So, what was the like it, for YouTube? It's gonna work. So I'm not gonna recap all the 20 minutes video. But what I'll do though is, as you can see on the right side right here, it's already trying to upload the video of Gian, so you guys can download it and listen to that video that you probably missed or you weren't able to listen. I don't know what happened, but I think it's only on the Demio side that was the issue. But just a recap of uh, what. Oh, we're still sharing. What is a concussion? So I do have some pictures that can help you to understand what is a concussion. So as you can see right here, um, when you have an impact, the brain will move inside your skull and will squish the like itself by the skull right here. So you can see that the skull could be a problem, and you want to try to deflect or the impact that you're gonna have, or even you want to prevent that situation from happening. So even like a car accident, you can have um, a concussion even, with a whiplash that you're going to have with your brain. So you're trying to prevent that from happening. So you can see here when you receive a ball, a baseball, right up your skull. that will create a multiple traumatic brain injury. So these picture, you do have it in your um, file that you can download right now if you're interested into looking at these pictures a little bit more. Um, and I also uploaded all the documents that you can use. So the CRT5, the SCAT5, this is the other document that I'll talk about, and the one for kids, and the biomarkers. So all these documents are free. You can download them online. You just have to write down CRT5 or SCAT5, and you will have access to that document. So if you are a person who is a trainer with the people in the sports field or something like that, you can download them prior for that. So, like we said in the document, you want to follow the red flags. The red flags are pretty important because these are signs and symptoms that the person may have a concussion. Now, like we said in the video, you don't want to be the doctor here. So you're not the doctor, you're not going to diagnose, but you want to see what's happening. All right. So, for example, if you go on, like you're a trainer on a team, and then you see an injury happening, somebody breaks his arm. It's pretty an obvious injury. You see it. You see the bones coming out. Like for sensitive heart, I'm really sorry, but you're gonna see the bones coming out of his arm, for example, and that's an obvious breaking home bone. So you want to like do the first aid properly for that. Now, sorry, a concussion is not the same thing. A concussion is not a visible injury that you can see with your eyes, with your bare eyes. So that's why you want to go with signs and symptoms. Even if the person show some signs or don't even show some signs, but you saw the impact, you can suspect that he has a concussion. Because concussion can happen, not concussion, but symptoms can happen, can show up a couple days after the injury. So you want to keep that in track. So the SCAT5, if I open that document, this is the SCAT5 document. It's a really big document, but you will find on that document a lot more detailed questions and some other tests that you can do um, for your athletes if you are a trainer for your sports team. Now, the red flags that Gian was talking about, they're right here. And if you go further in the document, you can see also other like the red flags or the level with a scale. How do you feel? How that person has these red flags, like how intense they are. Now, as soon as you have a red flags, send that person to the hospital because even with a questionnaire, you don't know if that person has internal bleeding in the brain or anything that can be complicated, like any other complication to the injury. Like I just said, you don't see the concussion. It's not something that we see. It's something that you will suspect. So that's why you want to send them to the hospital. So that was with the SCAT5. Um, Now, she mentioned Gian, that when you are a trainer and you see an impact, for example, a person plays hockey and you see an impact on the ice, and then you don't know if he has a concussion, but you saw that the impact was probably that person have a spinal injury. Don't move that person if you don't know how. So there is some course in the military that we do provide. It's with the CAF ATP course, CAF for Canadian Armed Forces, ATP for Athletic Training Professional or something like that. Course they do taping one, taping two, and the first responder course. So the first responder, it's like an ambulance. You're gonna be a medic. Your job is to be the first responder on the course, on the field, on the ice, and you are the person who's gonna be calling the ambulance, and also immobilize the person and even put him on the platform if necessary. If you do suspect that he has a spinal injury, and you know how, you can do what it takes to move that person out of the ice and bring it closer to the ambulance. If you don't know how, or even if you know how, but you don't have a lot of practice, my best recommendation on that would be just immobilize that person and wait till the ambulance arrive. When the first aid will arrive, they do that every day. They are certified. They do practice. They do training, so they will move that person if you do suspect that that person had a spine injury. But the tip that I can give you right now, as a trainer, because I am a trainer for multiple teams, the first thing that you do is look always the match. So if you are a trainer for a hockey team, the best thing to do is to always look what's happening on the ice. That's just an example. And if you look what's on the ice, you will see the injury. So if you do see the impact, for example, the video I showed with Zdeno Chara and Max Pacioretty, when he hits the board, as me as a trainer, even if I am not on the ice, I don't know what happened. I saw the impact. I will suspect a spinal injury and I will suspect um, a concussion. Now, this is kind of like your 80% intake. So you know almost already what's the type of injury and you know also what to do. So if that was me, I would jump on the ice. I will already take all my kit because I know I need all my kits. And I will go towards Max Pacioretty and I will say, to everybody to leave some space because we need space. When you arrive to that player, you don't know if he's conscious or unconscious. If he's like you don't know. And anyway, he has a helmet, so you don't even see his eyes and everything. My big recommendation is don't arrive behind him like that because you might scare him if he's conscious, and if you do scare him, he will move, or even he will look just up like who's coming. You don't want that person to move his neck. You don't want to move nothing on his body. So you come on his visual and you're gonna talk already. Don't move. All right. So you're arriving at that person and you just don't want him to move. So that would be the best recommendation, because the first thing you don't want is that person to move his spine unintentionally. And the second is you just immobilize his neck and you wait till you call the ambulance and you wait till the first aid arrive if you don't know how to do that. If you are interested into becoming a first responder, you can. As a military, even as a PSP or a staff, you can ask to do that course. I was really lucky because the instructor on that course was really really interesting and really fun, and you can learn a lot about first aid and first responder. So this is uh, like the brief thing that I'll tell you guys how to do a first aid on a person that you suspect a spinal injury and a concussion. The other thing is that we can do is you can also continue following some mocks. Mocks means massive open online course. And last year here the base actually we had a course which was a partnership with the University of Calgary and the University of Laval in Quebec. They did a mocks on concussion, and it was a really interesting course, and this is where we got all also in our information. But the thing that we can do is that I can tell you is the progression into concussion in the past 20 years is they did a lot, like a good, amazing progression on that. Because back in 20 years ago, the only thing that we were doing, it's only approaching the person and saying, how many fingers do you see? Or what is your name? What is the score of the game? Now, today, as you can see with all the charts, we are a little bit like we are far away from that approach because we know that it's way big, way more than that. It's not only oh, you see two fingers, you're good to go. Go back to play. Um, but the problem is right now, even with an MRI, even with a scat can, the image that it does provide, it's not something that it's clear enough for the medical to see what's the further, what they can do if you did recover fully from a concussion, and if you are ready to go back to play. So we still have we needs a lot of study, we needs a lot of research on that, still as today in 2020. So we hope that in the future, and we are pretty certain that in the future we're going to have probably a different approach on a concussion, but we still have to do a lot of studies. And you know what, Ryan Carey will talk about it also, since he works for the Canadian Foundation of Concussion, so he will talk to you more about that too. But what my goal would be with you today is also to say, if you do suspect that you have a concussion, there's a protocol to follow. The doctor will give it to you, the physiotherapist, or even anybody. Like even me, I do have the protocol. I will give it to you. But the thing is, you can also not know if you have fully recovered from that concussion or not. If you do, if you are an athlete, if you are a military, and you are suffering from a concussion, my first recommendation is recover, take the full time that it needs to recover. Even if you don't think that you have any signs and symptoms, it doesn't mean that you fully recovered. As I just mentioned, the research are not up to date, or they're up to date, but they need more research, more study to really better understand what is a concussion. And if you kind of like recover, but you go back too quick to work, or too quick to the sports that you're playing, you may not recover fully, and you may be more susceptible to have another concussion. So my best recommendation is to follow by the letter the recommendation that we have on concussion. So you'll see a lot, even in the, one of the problem that we see a lot today is even in the professional sports, we see a lot of players having a concussion and coming back to play way sooner. One a good example. I hope you guys are hockey fans, but Eric Lindros was a good hockey player back in the day, and he did receive a lot of concussion in his career, and he went back to play really quick. The starting of his career, he was pretty much a fighter back in the day when hockey included a lot of fights, and a fight, it's a lot of contact, a lot of hit to the head, and they kind of like they may have like a lot of concussion or traumatic brain injury, and he just went back to the penalty box, recovered from the fight, and went back on the ice right after. You can even see it today. There's a lot of good example that you'll see another a player like a. It's kind of obvious that that player just got a concussion, and he's going to be back to play as soon as possible. The thing is, you need to be proactive. So, as a coach, as a trainer, or even as a player, or even as a military, when you do have a concussion, you want to recover fully, like as I just mentioned, and also think for all the others. So, if I put yourself into a perspective that you're military and you're in a combat trade, and you're doing an exercise, you got a concussion, and you want to come back to the exercise prematurely. Um, how does that put you? Does that put you 100%? Are you going to be the person who can support your teammates, your brother in arms right next to you? Are you going to be the person who can defend them if they need your support? If you do have a concussion and you do have some symptoms during the exercise, you're going to put everybody else in danger. It's the same thing for a player, a hockey player or a basketball player. Even if you're a teenager, and you want to say that the recruiters are in the stands watching you, and they will make a decision of your career during that only game that you want to play, and you want to come back to play too soon, you may have symptoms, and you may lose the game because of you. Even if you are the best player in your team, doesn't mean that you're going to be the best player on the ice at that time or on the field at that time. So sometimes the best decision that you can make is to sit on the bench, be a leader on the bench, and just show by example what is a full recovery from a concussion. It's not pleasant for sure, but that is my recommendation for the recovery part. So you got to take your time. You got to make sure that you are doing all the exercise that we give you, and also take the time to let your brain heal 100%. If you don't, it might be a chronic problem or even like more susceptible to have other concussion. You can also, if you are a trainer or you work with a organization, a sports organization, my recommendation would be you can prevent that from happening. So what we do is, for example, I'm going to take hockey again, but I'm gonna take hockey and another give you guys another example. But hockey is before a game. I'm gonna look at all the doors if they close properly, if they don't have any gap in it, if there's no chance that the environment will create an injury. So I do my round check before the game. If I see some stuff that is sketchy, or I don't know if it's going to be good for the game, I am responsible. The coach are responsible also. The referees also to take measures to prevent that from happening. So the first thing we want to do, obviously, we want to have a hockey game. We want to have a match, but we want to make sure that it's going to be done safely and equally on both sides. For soccer, that's the same thing before the game, and I was a trainer for a lot of soccer team. You just do your round around the soccer field to see if there's some gopher holes. Here in Wainwright, there's a lot of gopher holes, but anywhere where you are, you could watch to see if there's any anomalies on the court, and make the change before the game start. This is the best way to do it. You can also follow what we just said about not modifying your equipment, because modifying your equipment may decrease the efficacy of your equipment. So you want to make sure that you're not doing this on purpose, and you're gonna prevent as much as possible. The thing is, when you do have a concussion, the recovery time may vary. Most of the time, not most of the time, but you'll see that it may vary from a week off to a month, couple months off. And as you can see with Sidney Crosby, his example, he took a full year off. So, like I said, recovery may vary according to the doctors, according to the full recovery protocol they have. So, you don't want to you don't want to like put yourself into a concussion situation. You want to prevent that from happening. Um, yeah, so all the documents are there. I gave you guys, just want to make sure if I did, the reflective tool in the handouts. The reflective tool is if you work with sports organization, you can follow it. You can uh, uh, follow these questions. These are kind of questions that you can try to answer, and they're going to help you to prevent any injuries or concussions during sports. Now, we're not going to erase it. It's not going to be 100% efficient, because every time we play sport, we increase our risk to have injuries. That's part of the game. Same thing for the military. Every time we do an exercise, we're going to increase our chance to have an injury, or even worse. So that's why you want to prevent that. You want to be safe the whole time, and prevent all that from happening. So, for the people who are still here, do you guys have any questions according to concussion? did this podcast or this webinar help you guys to better understand what we're saying about concussion? So you can write that in the comments. If you do have any questions, you can put it in the comments, and if not, that's going to be it for the first part. The second part, we're going to talk about, we're going to have a little bit more details about the recovery, the management of the injury, and the third part, we will have our special guest, Ryan Carey. So I don't see any, oh, no questions for Tracy. Yeah, I'm really sorry about the demo. I don't know why it did that. The video stopped, not stopped, but they couldn't hear any volume, anything coming out of that video. So I was a long 20 minutes for you guys. But on YouTube, it's gonna be playing according to what I'm telling you guys. Yeah. So everything I said in the video, I was talking. In the video, I was talking about particularly the helmet on hockey players. So I was saying that according to my experience as a trainer, they are modifying their helmets. They're putting tapes on the straps. They're uh, like modifying their cage in front of them. They're not even like following the protocols of a helmet. I even saw some hockey players taking their helmets off, taking some pads off. Um, and in that video, I was saying that this is not safe. You're not helping yourself. You're not showing by example that you are safe, and you're not preventing any injury from happening by doing this. So, as a coach, as a trainer, as a referee, we have to show, and even as a player, we have to show a good example, a good leadership, and we want to prevent that from happening. So we shouldn't be allowing this from happening. I know it's in kind of the culture of hockey. For example, we could see some stuff like that in other sports, but we're not talking about enforcing cultures. We're talking about preventing any injury and a concussion. As you could see in this podcast, it's not something that it's fixable in 3 days. When you have a concussion, it's there for a while, so you want to really prevent that from happening. So yeah, thanks for Tracy for bringing that up. You probably guys saw that Tracy was communicating with me during that video. She was saying that we couldn't hear myself talking, which I always talk too much. But on that note, thank you guys for being here on Demio. Put on your calendar July 23rd for part two, and August 6th for part three. And yeah, thanks for being here with us, and we'll see you next time.